What is tuberculosis and how to stay safe? Tuberculosis, or TB, is a progressive and long-term disease caused by mycobacteria and typically affects the lungs by causing infection. TB can manifest itself in the form of many other conditions that affect the central nervous system, the bone, and many different organ systems. TB has been intriguing scientists and even philosophers for ages. Hippocrates thought that tuberculosis is an inherited disease, whereas Aristotle and Galen were convinced about its contagious nature. Scientists now know that TB is a dangerous infectious disease. It's estimated that around 2 million people die from it each year. In 2016, it was reported that this disease killed 1.7 million people. It's believed that 15 million of the world's population have the active disease at a given time, and 1/4 of the world's population is infected with TB. We will specifically discuss TB affecting the lungs that are usually caused by the mycobacteria present in aerosol droplets. The infection is initiated when these mycobacteria find their way to the lungs inside the human body. The dispersion of the disease is mostly noted to be through coughing and other respiratory movements. The body's response to infection depends on the strength of the immune system and also on the strain of bacteria, as some strains of mycobacteria are more virulent than others. The Nemesis of TB is growing, and scientists are finding it hard to limit its spread. Even though there is a presence of vaccines against the disease, the progress in disease containment is not satisfactory. There is an identified need of the development of new and effective to control the disease better. The mycobacteria have also developed resistance against various drugs, which are presently available to combat the disease. Drug-resistant TB cannot be timely diagnosed, and the treatment against it is usually ineffective. This situation with drug-resistant TB is resulting in continued transmission, increased resistance, and low recovery rates. Drug-resistant TB is a primary concern for scientists. Poor adherence to treatment and inappropriate drug regimen is a primary reason for causing drug resistance. Awareness plans are needed to avoid the factors that lead to drug resistance. The most typical symptom shown in the disease is coughing. Still, in some cases of moderate and even severe disease, the patients may exhibit no symptoms. The only sign shown could be a feeling of being unwell, along with fatigue, decreased food intake, and weight loss. The cough may be with minimum yellow and green sputum in the beginning, but can become more productive as the disease progresses. A low fever is also common in patients, but this symptom can vary in different patients. Night sweats and difficulty in breathing may also be experienced. Measures to stay safe from TB involve covering the face with a mask approved for TB prevention and avoiding close contact for long durations with someone who is suffering from the disease. The patient should be advised to stay at home, avoid visitors, and cover their coughs with hand or tissue. Bacillus Calmette-Guerin vaccine, more commonly known as the Bcg vaccine, is the most important vaccine for the prevention of TB and is given to more than 80% of the world's children. It's highly advised to get your children vaccinated. If you have any questions, please share them with us in the comments section.